Okay, so hello everyone. Today I'm going to talk about explainability and uncertainty in the case of time series classification, and in particular clinical time series. So, and yes, my name is Kristoffer, PhD student here at the UiT Machine Learning Group. Um, so I'm going to first just talk about explainability for time series, so we're kind of uh, on the same page with this, and then I'm going to talk about some particular challenges that arises when we consider clinical time series, and then I'm going to present our method for addressing some of these challenges. And in the end, I'm going to show you some results on some real-world clinical data sets. So as we've seen today, the interest in explainability in deep learning has kind of there's been a lot of interest in the last couple of years, and there's probably many different reasons. But as deep learning kind of moves into new domains where you don't just care about the prediction, but also about the explanations, this will become even more and more important. Um, and I think in the last couple of years, we've come a long way with these explainability techniques, but maybe particularly for images. In my experience, there's been less focus on time series data, but in a medical setting, time series data is also a very common modality. So we will also have to kind of address the explainability challenges for this type of modality. So when we talk about explainability for images, it's often what pixels influence a prediction, as we've seen in previous presentations today. And in time series, it's very similar, but instead of pixels, it's what time steps influence a prediction. So to illustrate, I have an example here. So here I've trained a deep learning model to classify some time series, and this is a synthetic data set. So there are 3 classes, and one of the classes is characterized by having this significant dip at either the start or the end of the time series. And what you can see here is that at around time step 120, you have this significant dip, and this is highlighted as being kind of the relevant part of the time series for making a prediction. So this is kind of what we mean about explainability for time series classification. Now, for the case of clinical time series, there are some kind of additional challenges that we encounter. So one thing that I think is more challenging for time series is that for images, even if you're not too familiar with the data, you can still recognize an object. If you get an explanation and you see something is highlighted, it's still kind of, you can see that there's something in the image. But for time series data, you often have to have kind of a domain knowledge about the data. So for instance, what does an increase in this time series mean? What does, okay, so it has a periodicity of this and that, and it can often be challenging to kind of interpret your own explanations, and you typically need kind of an expert to tell you, do these explanations make sense? Another thing is that you typically don't have too much data, which is usually a challenge for deep learning models as a whole. But in our experience, this also leads to that you can have a lot of variation in the explanations. So by this, I mean that you can retrain your model and suddenly you get a different explanation for the same sample. So we have been looking into addressing some of these problems. Of course, the first point is difficult to do without getting kind of, you need help from somebody with domain knowledge. And luckily, we do have that with our collaboration with the University Hospital here in Tromsø. But for the other part, our idea is to kind of exploit this limited amount of data and use it as a strength. So what I'm going to present to you today is based on our recent paper, which you can see at the bottom here. It's also available on arXiv if you want to have a look. So the idea is basically to use ensembles to model the uncertainty in the explanations of the model. So here a couple of details about the framework. We use what's called a fully convolutional network for the time series classification, which has been shown to kind of do well in these benchmark tasks. We use class activation mappings to get the explanations, also like a widely used explanation technique, which we saw earlier today in Lars Kai's talk. And then we use ensembles to estimate the uncertainty in the explanations. And of course, using ensembles for uncertainty estimation is nothing new. We saw it in the talk yesterday, and also similar things in the talks earlier today. But it fits very nicely in this setting of clinical time series, because kind of the main challenges often with ensembles is, let's say you have a big convolutional network like a ResNet 50 and a big database with lots of samples. That it can become very kind of computationally impractical. But in this case, when you have kind of time series are not too long and we don't have too much data and you don't need too many too large models, that means that we can easily train an ensemble of convolutional networks. And it's been shown, for instance, in this paper from 2017, that these uncertainty estimates are quite reliable and also actually quite well calibrated, if we remember from the talk yesterday about uncertainty quantification. So the framework looks like this. It's quite straightforward. So we train convolutional networks independently. And after they're trained, we get a new sample. This sample is passed through all the networks, so we get M predictions. Then we use the class activation mapping to get an explanation for each of the predictions. And in this way, we can take the mean over the explanation, and we can also compute the standard deviation across the explanations. And this gives a kind of a very intuitive way of interpreting the uncertainty in the explanations. So for instance, if you have a time step that's indicated as being very important, but also has a high uncertainty, that means that maybe like one or two of the models in the ensemble thinks this is an important time step, but the other doesn't agree. But in the case that you have a time step that's relevant, but has a low uncertainty, that means that, okay, all the models in the ensemble agree that this is an important time step. And we also use these uncertainties to create what we call uncertainty filtered explanations. So essentially, we only want to see the explanations that we're really sure about. So we have this filtering scheme where we threshold based on the uncertainty estimates and say, okay, we only want to show the explanations that we're really sure of. So I'll show you an example of this. Now, in the paper, we have more quantitative results and show how these ensembles give more robust explanations. So if you want to look at that, you can check out the paper. But for this presentation, I'll show you some qualitative results. So first, we have a data set where the task is to identify if a patient might get an infection after surgery. So this is data we have obtained from the university hospital here in Tromsø. So we've taken blood measurements after surgery, and the blood measurements are of something called C-reactive protein, so CRP. And this is known to be correlated with the risk of infection. So in this case, we trained an ensemble of 10 models. And this is an example of a patient that did actually get an infection. So at the top row, that's the mean explanations across the ensemble. So green means that a time step is very important. And then the second row, that's the uncertainty of these time steps. So red means that a time step is very uncertain. And the bottom row is this uncertainty filtered explanation that I talked about. So as you can see, from the top row, okay, we have a lot of time steps that are being indicated as relevant. But from the second row, we know that, okay, a lot of these actually are quite uncertain. But if you look at the bottom row, then you can see that, well, it's actually just this incline at around 12, 13 days. That's we're completely sure that this is important. And then the question is, okay, is this a sensible explanation? Because as I said initially, that we know that the risk of an infection is correlated with an increase in CRP. But when we started looking at these results, we thought, okay, but at around 2, 3, 4 days, we also have an increase in CRP. So shouldn't this also be highlighted as being relevant? But after consulting with our the clinicians that we cooperate with, what they told us is that an increase in CRP after surgery is actually very normal for all patients. So it's kind of the body's reaction to like a major to major surgery. So that wouldn't actually distinguish between patients that can get an infection and ones who don't. But what is typically a sign of an infection brewing is that if the CRP rises after several weeks after surgery, that's typically a very good sign of, or a sign of a possible infection. So in that sense, it shows that our model has been able to learn kind of that, okay, this initial top won't discriminate, but this late top, that's actually a sign of an infection. Then we have another example on a different data set. So these are time series of the heart. So these are echocardiograms. Similarly, we trained an ensemble of 10 models. And the task here is to try to detect heart attacks in echocardiograms. So again, the top row is the kind of mean of the ensemble, and then we have the uncertainty, and then the uncertainty filtered explanations. And if we only look at the top row now, we can see that, okay, there's a lot of time steps in the input that is being highlighted. We have this initial part, and then this decline, and we also have this bump towards the end. But if we look at the uncertainty plots, that we see that there's actually a lot of disagreement on many of the important time steps. So if we now look at the uncertainty filtered explanation, you can see that, okay, there's only this rise at around time step 20. That's kind of all models agree that this is an important time step. And again, this is what I mean by the, is this a sensible explanation? It's hard for us as machine learners to know, but the clinicians we collaborate with said that this, so one of the nice things about echocardiograms is that they have a very kind of regular structure. So the doctors have a good understanding of what a normal heartbeat looks like and what an abnormal one looks like. And what they told us is that this kind of abrupt change in heartbeats is a very typical sign of heart attack. So again, it shows that kind of the model has learned something kind of some characteristics of data that actually match domain knowledge. And also that this way of uncertainty, filtering out uncertain explanations can also help in creating more clear explanations. So I think I'll just wrap up. So I hope I've shown you that explainability and uncertainty can be useful when evaluating models, but also in my experience when you're developing models to see if your models are actually learning to kind of learn features that you expect them to. And also, I hope I showed you that if we include uncertainty in the explanations, that we kind of can get more information than just these explanations, because I think just relying on the explanations can give you kind of a false trust in just, okay, these are the important time steps and that's it. But as we've shown, it's not always the case that the model is completely certain that this is actually an important time step. So I think with that, I will end, and thank you for your attention.
Thank you very much, Kristoffer. And